Tonight, we are continuing our series here on the News at 7 when it comes to tackling loneliness. We've spoken about the holiday blues, the ways groups like the United Way Connecticut can connect people with resources. And we've also looked at what it means to feel connected to society and how a belonging barometer can help to measure that. Well, tonight, we're focusing on another aspect of this epidemic, the physical impact of loneliness.
So biologically, individuals who are more lonely do have more stress. It impacts their hormone response as well as their immunity. And as far as behaviors go, they're more likely to smoke, less physically active, less likely to seek treatment. And all of those impact health outcomes, whether it be hypertension from inflammation happening in the blood vessels or from the sedentary lifestyle causing diabetes.
So when it comes to cardiovascular disease, the U.S. Surgeon General's report on loneliness cites studies showing poor social connections were associated with a 29% increase in risk of heart disease and a 32% increase in the risk of stroke. Loneliness can even affect your immune system. A study cited in the Surgeon General report found that those with 6 or more social ties had a 4-fold lower risk of developing illness when exposed to something as simple as the common cold. And loneliness can leave older Americans more susceptible to cognitive decline as well. In fact, it was found to increase their risk of developing dementia by 50%, even after controlling for demographics and health status. And that's a big deal because while most young adults have reported feeling lonely lately, the highest rates of social isolation are among those over 65.
So a recent study came out, the U.S. Pointer study, identifying 5 different domains that help kind of stave off Alzheimer's and cognitive decline. And one of the most important ones is social health. It supports your brain, and the more you're learning, the more input that you're having, the more connections that your brain is making. So it is hugely important to keep your brain active.
Now, that study that Victoria Kozar just mentioned says it doesn't matter who that social interaction is with. It could be with a relative or even just a casual conversation with someone on the street. Kozar is a 4th-year medical student at UConn and part of the Connecticut Collaborative to End Loneliness. She co-chairs the Patient Loneliness Workforce, which is developing ways health officials can better identify markers of loneliness.
Their aim is to have providers start to have these conversations with patients. The World Health Organization has outlined this new concept called social prescribing, where the primary care doctor is on the first line, are seeing these people, people who might not see anyone else, to tell them that they're lonely, to connect them with non-clinical services, whether it be someone to a senior center or a youth agency. So it's important to have kind of all hands on deck.
And the United Way of Connecticut already helps connect people to those types of resources, especially through that phone number 211. But part of the work of Patient Loneliness Workforce is doing is creating criteria and recommendations for primary care providers who ideally see patients regularly and can tell when someone is sort of slipping into a bad place.
You could be surrounded by people and still feel lonely. So I think the most important thing is just to kind of have candid conversations about how much social activity an individual is having. I mean, we talk about physical activity all the time. Who says social activity isn't something that we should talk about?
Exactly. And Kosar says those aren't just conversations we should be having between doctors and patients, but between family and friends as well. We can all do our part to check in on others. And remember, there's always help out there, no matter the social connections in your life. If you are struggling, you could call or text 988. The National Suicide Prevention Lifeline can get you counseling any time of day.